Hello, my name's Joyce Gibb. Thanks so much for being with me today. And I thought I would review some common labs. This is part 2 of a 2-part series. And today we're going to talk about the white blood cell count, which is in the complete blood count in the basic lab. And there's 2 groups of white blood cells or leukocytes. The first one are the granulocytes. And this got the name granulocytes because there's granules in the cytoplasm or the cell fluid, and that's how it got its name. And these granulocytes consist of neutrophils, basophils, and eosinophils. They're all white blood cells. They're also known as PMNs or polymorphonuclear leukocytes. So remember the granulocytes. They have granules in the cytoplasm of the cell. The second one of leukocytes are agranulocytes, and they're considered monocytes and lymphocytes. They do not have granules in the cytoplasm of the cell, and that's how they got that name. Agranulocytes, A meaning none or without. So monocytes originate in the bone marrow, and you'll see when somebody has an infection or a virus, the monocytes will go up, and actually they're like the Pac-Man, they clean up the debris. And lymphocytes are formed from the spleen, the lymph, the tonsils, appendix, and thymus. And lymphocytes are another form of white blood cell, and lymphocytes typically go up when you have a virus. So, but what do leukocytes typically do? They're really made to fight infection, virus, bacteria, parasites. And I'm going to give you a couple things that you can look for here. So what happens when you have a vaccine like the MMR, which is mumps, measles, rubella? What happens when a baby has a chickenpox vaccine? Then the white blood cells increase early on. If you have an acute viral infection, typically the white blood cells may go up initially. Lymphocytes typically are in the 30-some%, and they can go up to 44. The neutrophils are typically normal, and that's for an acute viral infection. Say like after you got a COVID vaccine, your lymphocyte count is going to go way high, and that should come back down. The monocytes can, go up in an acute infection also because remember, they're cleaning up the debris. They're the Pac-Men that are going around doing that. And that includes it's a recovery period when the monocytes are also elevated. And bands, they call them bands. They're early white blood cells that are made because of an infection. So if there's an acute bacterial infection, the total white blood cell count will go up. The neutrophils will go up. Remember, the first line of defense, usually greater than 60. And the lymphocytes are typically normal with an acute bacterial infection. I know when I worked on children's transport team in Columbus, little babies after they were born and they had trouble and they would struggle to breathe or they had, some type of defects. A lot of times when they were stressed during the delivery, their white blood cell count would always be up. I'm like, okay, why is the white blood cell count up? Is there infection here? And many times the blood culture showed was negative and the white count was up, and that's because of stress. So that can happen with adults too. So if there's a chronic viral infection, then typically your white blood cells drop. That sounds weird, but the acute phase, the white blood cells can be neutral, remember, but a chronic infection, typically the lymphocytes can go up too. So chronic bacterial infection, the white blood cells can go down. With a chronic infection, with acute infection, they go up. So there's a lot of ups and downs in these, but if you want me to help you interpret any of your labs that seem normal, abnormal, if you want to talk to me about your health problems, I would be glad to help you on your journey to good health. And remember, this was part 2 of the 2-part series. See the other one about creatinine. That is part 1. Thanks a lot and have a great day. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.